Going to the dentist or dental hygienist may not be your favorite thing to do, but proper oral hygiene is imperative for your health. Joining me today to talk about the importance of oral hygiene is CEO and registered dental hygienist Aneta Deddy. Welcome to In the Know.
Thank you very much.
Okay, so an important topic, a topic that is not important but imperative, as I said, for people of all ages.
Yes.
Let's talk about the basics. We're going to go back to grade 1 and before that, preschool, on what you need to know. And I know the rules are constantly changing about proper oral care, how to brush, how to floss, how often we have to do this. So let's start with brushing.
Brushing
How important is brushing?
It's very important, and usually is the most basic thing that you have to do. Usually nowadays, I think most of the people do brush, so it's very rare that you
Let's
see.
hope so.
It's very rare that you see people that don't brush, but most of the time they brush only once a day instead of brushing twice a day, and sometimes they brush a little too quick. So usually I say if you really have to brush once a day, because that's the way you chose to do, at least brush before you go to sleep.
Okay.
That's the most important thing, because all the stuff stays there at nighttime and it just causes all the bad stuff in the mouth. So if you're brushing only once a day, please brush at night.
So what happens, let's talk about why we brush. Sounds obvious, but your food and all the gunk and your saliva and everything that you've got from the day sits on your teeth, right?
Exactly. So all the stuff that sits there, it's the plaque that usually forms. As soon as we brush our teeth, the plaque comes back in our mouth. And that's why we have to brush a lot of times, so we can remove all that plaque off our teeth.
Okay. Techniques to brushing. I know this has changed so many different times, right?
Sure. So we have two types of brushing. So it's manual toothbrushing.
We've got our little teeth here.
I brought two, so I can actually see how you brush.
I'm being tested, okay.
So we have manual toothbrush or electric toothbrush.
Okay.
So what do you use, manual or electric?
I actually use an electric toothbrush.
Electric toothbrush. Also, the electric toothbrush are different ones. So you can have the round ones, or you
that's
can
what I have.
And that's a great toothbrush.
Okay.
Or you can have the straight one.
Okay.
So they are divided into Sonicare and Oral-B. So both of them are fine. It's just, it depends what you prefer.
Okay.
So if you use a manual toothbrush, usually you have, this is very easy because you don't have cheeks, you don't have the tongue, so it's quite easy to show and to do it, but it's very different in the mouth when you have all the stuff there. So to brush, you have to use a 45-degree angle, okay? So you kind of do a little rotation motion and you sweep it away.
So we're doing the little rotation and then
sweep it away. But it's a 45-degree angle.
Okay.
And why is that? That's because all the bristles have to go in the gums. So that's why it's a 45. If it's straight, it's very hard to have the bristles in the gums.
Right.
So that's why 45-degree angle, rotation motion, and sweep it away.
My guy obviously wasn't a very good brusher. Like
he lost the
pirate. And so years and years and years ago, we were told to brush like this.
Back and forth is the worst thing you can do.
Okay.
Because you can remove enamel and gum. And that's why later you have to do fillings or you have to do gum graft. That is not something small. It's quite, it's a surgery. So you don't really want to go there.
Right, okay. So when you're teaching kids, because I have two little girls at home, a 5-year-old and an almost 3-year-old, and we really have just done basic brushing with the baby.
Of course.
But how do you start teaching them this motion? Because it's pretty tricky to do that feathery motion.
It is. So that's why for that age, it's best if you can actually brush for them.
Okay.
What we usually suggest, I also have young kids, so I give them one brush and I take one brush and I do the brushing for them and then I let them do the brushing.
around.
So just, it looks to them like they're doing something.
Okay.
And also a good thing to do at that age is also get an electric toothbrush.
Okay.
So that's a very good investment
All right.
for them.
What about flossing?
Flossing.
Who likes to floss? Not me.
Yeah, I don't think there is a lot of people that want to floss. Flossing is something that people have tried, especially us as dental professionals, we have tried so hard, to make it as a routine for them, and it's still very hard. Probably I would say in my practice or the patients I've seen, it's probably 10% of the patients that they do floss. And a lot of times they say, when I usually ask, I don't usually ask, do you floss? I say, how often do you floss? And they say, once or twice a week. If it's once or twice a week, probably is none. So that's why it's very important.
And you can tell. I always say, don't lie to your hygienist because they can tell. They're in your mouth.
Definitely.
So when people say, I floss once a day, and you're like,
And
sure you do. Right.
I usually try to be nice, so I don't really, like want to say, but I say maybe a little bit more often. So
Yeah,
probably, add a few more days to your week just to make sure, that it's easier for them. I usually suggest you have waxed floss. That's very important. And I think you said earlier that this is very thick.
Yeah.
It's actually good.
Let me show that to the camera. Because this is it looks like a ribbon almost. Look at that.
It's called tape floss.
Okay.
So it's thick and it's actually very good because it gets into the smallest surfaces.
Okay. We're going to get a close up. So you've got a whole bunch of different, there it is.
Yes.
Look at how thick that is.
It is very thick, but when you actually floss, it doesn't feel like it.
Wow.
So it's quite easy.
And so what else do you have there? Some ones that are all colorful and
yes. So these ones are floss picks. So I have some that are regular ones and some are for kids. They make them different colors and just to make them fun for the kids. But these ones are also for some patients that they don't like the manual floss. So they say, oh, it's too difficult for me. So I usually suggest to have floss picks so they can just floss and you can throw it away.
And so here, I'm going to hold this one up too. What are these things? I've seen these in the store.
Yes, these are actually very good. These are called rubber tips or soft picks, we call them. So they are great because they get also in the smallest areas and they work pretty much as well as floss.
All right.
And they're very easy to carry with you and you can use them anywhere because you can just throw them.
And better than a wooden toothpick.
Yes.
Okay.
The wooden toothpick, you have to be very, very careful because you can actually harm your gums. And if you get a lot of bleeding after the flossing, all the bacteria that is outside, it actually gets into the bloodstream.
Okay.
So it's not so good.
Okay. I was one of the many fortunate people to have orthodontic care. Not once, but twice. And I have this beautiful retainer at the bottom. You have a floss here. Show us really quickly what it's about before we go to commercial.
So this is called Super Floss.
Yeah.
And it's very easy to use because you have, this is like a needle.
Oh.
And after, this is floss. So you just place it underneath and you can just floss.
All right,
So
let me take a look at that. We have to take a short break. When we come back, we're going to talk about ages and stages of dental care, and we're going to debunk some myths with Oneida. Don't go anywhere. More in the know after the break. Don't forget to floss.